Hello everyone. Today I am going to tell you in brief about the shake test. So today you will learn what is the usefulness of gastric aspirate shake test, what is the procedure and how will you interpret it. So in usefulness, it is very simple, rapid and reliable test for estimating the lung maturity in preterms neonate. So we will be able to identify the preterms neonate, those who are having the risk of RDS, respiratory distress syndrome. Ideally, it should be performed immediately after birth in less than 34 weeks gestation age preterms neonate. So we will be able to identify those who are eligible for the prophylactic surfactant treatment. So according to the interpretation of shake test, we will be able to identify the preterms neonate less than 34 weeks, those who are going to develop the RDS, because sometime at the time of birth they are not having the all the signs symptoms of RDS. But by the interpretation of shake test, we can give the prophylactic surfactant treatment if they are having the risk of development of RDS. So how will you perform the shake test? Just you have to take a test tube. Then you have to mix the zero point 0.5 ml gastric aspirate fluid with the 0.5 ml absolute alcohol, 95% ethanol. In some of the literature, it is mentioned that 1 ml absolute alcohol should be mixed with the 0.5 ml gastric aspirate. Ideally 50-50% we should mix. It is 95% ethanol. We have to shake it for 15 seconds. Then we have to allow it to stand for the 15 minutes for the interpretation of the result. So this is the procedure. Now how will you interpret the shake test? So if there is no bubble or in less than 1/3 of the circle of the test tube small bubbles are formed, we will label as a shake test is negative. No or very little surfactant is present and 60% preterm neonate will develop the RDS if the shake test is negative. If small bubble formation between 1/3 to 2/3 of the circle of the test tube, shake test is intermediate and 20% preterm neonate will develop the RDS. If small bubbles are formed to more than 2/3 of the circle of the test tube, we will label as a positive shake test. That means adequate amount of the surfactant is present in the lung, less than 1% chance of the developing the RDS. So whenever a shake test is negative or intermediate, we can give the prophylactic surfactant to these preterms neonate. So it is very useful and reliable test. At bedside we can perform easily and clinically also and by X-ray also we have to interpret it. So this is about the shake test. Thank you so much.